Okay, so a lot of us deal with patients who have got knee arthritis, and a lot of these patients don't require any surgery. And these are the patients in our clinic who we want to see whether they get better with our analgesics, whether we can try some nutraceuticals. And each one of us have got our own preference with regards to whether it's a hyaluronic acid or whether it is diserine or glucosamine. So this is one topic which I'm going to touch upon today of what is the present trend in the role of nutraceuticals in our practice. So these are my declarations. So we all know about this article from Lancet, which tells us about the increased incidence of knee as well as hand arthritis in our practice, and is going to increase exponentially. We all know now that osteoarthritis is not same as aging, and definitely it is the inflammatory process in the knee joint which causes this osteoarthritis. The risk factors we are all aware of. I'm going to skip this. And this is the vicious cycle of pain, loss of motion, increased stiffness, and this continues. So this is a pyramid which we all follow in our practice, which ends up with a surgery, but there's a big load of patients which we treat non-surgically. So it's a multimodal approach with the help of exercise and lifestyle changes, medications, and over-the-counter medications. So we should not ignore the non-pharmacological interventions, which definitely include a lot of physiotherapy and weight loss management. Talking about the nutraceuticals, so we are going to touch upon 4 things essentially. One is the collagen type 2. The second is Boswellia serracea extract, which is the aflapin, the curcumin, and the mobili. So type 2 collagen is nothing but is the substance which reduces the inflammatory response, specifically the T cell response. Now, where do we obtain it from? We all know it comes from the chicken sternal cartilage. What the molecule does, it goes and interacts with an organ which is there in our intestine, which is called as the GALT. So basically, a small amount of collagen, it goes down in our intestine, it causes an antibody response in the intestine. Only so that an antibody response in the knee does not happen. The knee antigens do not cause an antibody response because of some amount of memory happening in the intestine. So what it does is nothing in the knee joint directly, but indirectly by having its action on our intestine. So as you can see the intestinal microflora, the gut lumen, the lymph node, and the T cell induction. Right. Now this also happens in the duodenum as well as the small intestine, and it are very small doses of collagen. This is the clinical data which supports the efficacy as well as the mechanism of action. We also have the hydrolyzed collagen which are in our practice. Now these are very different to undenatured collagen. This is almost like comparing apples to oranges, where hydrolyzed collagen has got an anabolic effect on the knee joint, whereas the undenatured collagen has got an immune tolerance response. Right, so this is a few articles which compare between the two. Now we'll also talk about the LOX pathway. Everybody talks about the COX inhibitors, but there is also the LOX pathway which causes inflammation and is also responsible for the cartilage degradation. So the aflapin, what is aflapin? We all know Boswellia serracea extract. So it is just a better version of the Boswellia serracea which we take daily. And this has got an anti-inflammatory response with the help of inhibiting the LOX pathway. The other thing which we are touching upon is the curcumin. We all talk about turmeric with milk. Now, is it any different? Well, in terms of action or mechanism of action, no, it is again a COX-2 inhibitor. But what is different is the bioavailability. Now, the haldi that we take as opposed to curcumin which is there, which is curcu life in this, it has got definitely more bioavailability in our body and definitely better COX inhibition. Well, we all use sodium hyaluronate in our practice, and mobili is again something which enhances the bioavailability of hyaluronate in our body. So it offers almost 70% absorption. So this is a clinical study which talks about the synovial effusion improvement, increase in the muscle strength, and about the reduction in pain. This is the few summary of the clinical trials. So of course there are some patients which are neither this way nor that way, and there is some role of viscosupplementation which can act as a stopgap for the same. So in all, it causes reduction in pain and inflammation, where we are talking about aflapin, which has got immediate effect, curculife, which has got long-term effect. Again, we are talking about mobili, which has got anti-inflammatory as well as reduction in the joint pain. And of course, the type 2 collagen, which has got the oral inhibition. So for this part, this is a take-home message where, of course, non-pharmacological measures are important, and we have a whole array of nutraceuticals to choose from. It depends on us what we choose from. Only other thing that I would like to touch upon is the role of etodolac. Now, we all talk about diclofenac, indomethacin, and so many etoricoxib in our practice. What is unexplored essentially is etodolac. Louis Pasteur was the one to talk about the chirality of the molecules. This is nothing but the mirror image. Our right hand and left hand are not the same. They are mirror images of each other. You cannot overlap them this way, right?
Thank you, doctor. Thank you. Please conclude.
Sure. So only one thing to talk about S-etodolac is that you don't need to have the I molecule to have all the side effects. By just having the S molecule, you can have less side effects, less gastritis, and equal efficacy.
Thank you.
Thank you.